welcome to the Digital Health Live Studio presented by United Healthcare. We're here at CES 2018. I'm Jarjour with Clear Voice Consulting, and I'm speaking today with Michael Jarjour. His company is ODH. Welcome, Michael.
Welcome. Thank you so much for having me.
So tell me about ODH. What do you do?
ODH stands for Outcomes Driven Health.
Okay.
Tell you a story a little bit in a different fashion. We start off by, we're heavily focused on healthcare. We take very complex healthcare data, try to simplify it, aggregate it into a format where you can really glean valuable information from. We add to that.
Who's the you?
We, in this case, you would be a provider.
Okay.
Very good point. Provider, in this case, insurance companies and payers, and then providers. Mainly the end users would be care coordinators at the insurance company level who would interact either with the doctor or respectively with a client or member directly, patient.
Okay.
We take that data then and also apply predictive analytics to really glean some insightful data out of them. And from that, then we go to the next step and say, let's provide our end users, in this case care coordinators, with what kind of insights into actions should you take on with a specific patient. So an example is, let's say you're diabetic. As a diabetic, you need to take your A1Cs, check your blood sugars. If you don't, you may be out of a norm and the medication may not control you. So the system then will tell a care coordinator, this is something that you have to interface with the patient with to actually ensure that the outcomes are positive and you maintain control over their outcomes. That's also ultimately allows you to maintain or bend the cost curve so you don't have spikes.
Thank you. So you're here at CES making a presentation. What was the gist of it?
The gist of it was we talked to a larger group about how there is a transition right now. The insurance companies are burdened by very high costs.
Yeah.
There's a desire to move to volume to performance. It's called value-based care.
Yeah.
So essentially now as a doctor, I'm not just given a fee for service. So a patient comes in, let's assume, do the blood pressure, whatever normative things I do, and I get a fee for that.
Right.
Now it's about
regardless
outcomes.
of what happens.
I agreed.
Yes.
Now it's about outcomes. So essentially, how good of a job did you do to control the patient, maintain a healthy environment, and ensure a positive outcome? Make sure that the costs are managed well, and that's how you are remunerated accordingly. And so we talk heavily about that.
And so your product
and
or
so
your
our
company helps to enable that process.
Exactly. So it provides a technology aspect.
Yeah.
Because if doctors are taking on risk,
how
do they know really? Did they do a good job? Not a good job? Did they actually control the outcome? Did they reduce risks? This is what we provide them insights around with. And we also make sure that the insurance companies and doctors are tightly integrated so both have keen insights into that information.
Fabulous. Thank you so much, Michael.
Thank you. Thank you for having me.
Thank you for joining us here at the Digital Health Live Studio, sponsored by United Healthcare. I'm Jarjour, and have a good day. Thanks.